All right, I think it is time to get going.
Hi, this is Rosa Villegas. I also have Rachel Diaz and Maria Gutierrez sharing in my computer.
Oh, great. More the merrier.
Okay.
Happy April to everybody. It's April 21st. If you're watching a recording of this, some of the information might be out of date. So always be sure to look at whyimmunize.org or cdc.gov for any of your most up-to-date, accurate vaccine information. We do want to start by saying thanks to everyone who completed the evaluation last month. We really review that stuff to make these tip sessions even better the next month. And we also realized in reviewing the evaluations, we had asked people what is something that we maybe could have done better. And one of the things was you're not explaining this HPV vaccine thing in a way that we understand it. So Macrina, if you could review with us HPV and invasive HPV disease in Native Americans, and which vaccines do we use for our Native American Alaska Native patients? Oh, and you're on mute still. And, you know, while she's unmuting herself, we are putting the evaluation link. It's in your chat. If you didn't complete it last month, go ahead and complete it because you get a prize mailed to you. So you want, and it's a good prize. So you want to make sure you complete the evaluation if you haven't already.
Okay, so HPV is one of those things that I always need to have my notes with me because the schedule changes sometimes based on age, but this is really something really important to remember. So there are 3 current HPV products on the market, and they're right here on your screen. One from Merck, one from Sanofi, and one from GlaxoSmithKline. The important thing to remember when we talk about Native American and Alaskan Natives are the PRP-OMP HPV, which is a PVAX HPV. Now, we do have some combined vaccines that actually have HPV in them as well. Pentacell and Vaxelis. And Vaxelis does have that PRP-OMP in it, which you think would be good news. And it is, but for the Native American and Alaskan Natives, it's not, you can't necessarily use that vaccine. So here's why you want to remember PVAX HPV, the PRP-OMP, is that the risk of invasive HPV disease at younger ages is higher in this population. And so based on the seroconversion rates, 60% after the first dose of that PVAX HPV compared to only 20% for other HPV conjugates. So this is why this vaccine is strongly recommended for this population. Now, when we talk about Vaxelis or the hexavalent vaccine, even though it does use that PVAX HPV, that PRP-OMP, at this time, they do not recommend using that in the American and Alaskan Native population because they're just not sure of the seroconversion rates that they're going to get early on with those early doses. They do use a much smaller dose, half the dose in this combined vaccine. So you still have to use that PVAX HPV. So for now, I hope this helps. Again, this is one of those things where I need to have a little note next to me all the time, just to remind me.
Does anybody have any questions that you want to ask? All right. This comes up every year. We used to do tips just in the summer, and it always pops up. It's a good reminder, I think, to keep going over it. So, all right. So we always have our Dr. Nick COVID-19 update, but Dr. Nick is on vacation this week. So we have our update by Macrina, and I know that ASIIS met yesterday.
So ASIIS met yesterday just primarily to talk about those boosters, that second booster for the population 50 and older. And I'm not going to define them as CDC defines them. We are not older adults 50 and older. But what they did was to discuss the data. And that information was chosen from some Israeli studies, very small study that was done that showed that folks of an older age who got that second booster actually had less severe disease, less hospitalization, less death. So they took that small study and they actually implemented it here in the United States. So 50 plus is recommended to get a second booster, especially those that are immunocompromised with chronic medical diseases, and definitely 60 plus, because we want to stop severe disease, hospitalizations, and death. And I know right now we're all a little crazy, right? Because we're getting all sorts of information. We watch the news, it says one thing, you watch another news, it says another, then you have CDC and you have ACIP and you have the FDA and you have all this information coming at us. We have you wear masks, you don't wear masks, you have a green, we talk about community level spread. This is going to be a little crazy time for most of us because now we're moving slowly into treating this like any other vaccine preventable disease. So I think there's going to be more to come. And as we move with this disease going into how we treat other diseases, whether it's flu or RSV or mumps or anything else, we're going to be moving into more of a normalcy. So I guess, like I said earlier today, one of my favorite movies, just hold on, it's going to be a bumpy ride. But we're all going to get through it together, and we're all confused together, and we're all frustrated together. But we'll get there.
We've all been through so much change in 2.5 years. So this is going to be the, now another shift into treating COVID-19 as endemic, which it will be. And it won't be creating all of these disruptions. It's just going to be like how we treat other things. So that's going to be, it will be hopefully the last of that big shift change. So just to clarify, the second booster dose, they looked at Israeli data, which looked at people over 60 plus. But CDC is recommending a second booster for Americans 50 plus. That's what our recommendation is, right? That's how, yeah. Okay, so 50 plus, and we'll have continued updates next month. So with Dr. Nick. So if you have other COVID kinds of questions, please feel free to throw them in the chat or let us know so that we can get those answered for you next month. So today we're going to talk about how do you empower patients and families? How do you answer those common questions, overcome those common objections? And we're really hoping that you will all interact on the chat or unmute your lines and tell us how you respond to all those questions. We're also going to hear how Macrina responds to these common kind of questions when she gets them in clinics. But before we dig into those specific questions, we thought it would be good to just give some kind of general principles about how we guide these kinds of conversations. Because life is not scripted and vaccine objections are not scripted, and you hear some normal questions. I'm sure you hear the same question 15 times a day sometimes, but you also hear some really crazy stuff, and you just need to know how to respond to those crazy things or questions that you don't hear all the time. What crazy stuff do you hear, Macrina?
Well, sometimes people just need to ask. Sometimes people will ask like a crazy question that I don't really know how to answer. Like I hear that HPV given at an older age will, no, I'm sorry, the HPV given younger will make my daughter infertile. And I'm like, and that's a hard question to answer because you really want to say no, but what you say is no. I've never heard that before. And then a lot of responses like, okay, I just needed to ask and get it out and have someone say no. So sometimes all you need to say is, I've never heard that before. No, it cannot do that. And then most people are like, okay, great. Because it's just been kind of swirling in my head for a while and I just needed to get it out there.
Mm-hmm. All right, so general tips for how to talk to your patients and your families. Number one, that we always feel like we need to remind you is that we need to present vaccines as the default option. This is an evidence-based strategy to improve immunization coverage. So saying today you're receiving 3 vaccines, today you are getting your flu shot. That is a strategy that will result in higher immunization coverage. And we need to remember that willingness to accept vaccines is really on a continuum. And most people are in this kind of passive acceptance phase, somewhere in the middle, where if you tell them that's what to expect and that's what they'll be doing that day, they will just they'll just comply. We don't want people to feel like they have to have a question. So they have plenty of questions. They're wondering about potty training. They're wondering about bedtime routines, anxiety, depression, what their teens are doing when they're not around, social media use. They're walking into that appointment with a lot of questions anyway. And we want to make sure that you create an environment where they can ask those questions, but making sure that you just recommend vaccines like you would any other health service that's recommended at that visit is a really important strategy. When you do get people who you think might be concerned and you can see it in their eyes and in their body language, or maybe they just say something, it's really important that you ask them what their specific concerns are and that you make sure that they feel heard. So just for fun, we're going to do a little role playing about how this might happen. So patient walks into the exam room and is greeted by this wonderful nurse who says, "Nurse."
Oh, I'm sorry. Today I'm getting 2 vaccines, and as you can tell, I'm really excited about it.
She is thrilled about it. So the patient asks which ones, while wondering, why are you wearing those boots in a doctor's office?
I say, you know what? They're 2 of my favorite vaccines, Tdap and flu.
And Macrina has lots of favorite vaccines. I don't know about getting the flu shot.
So what are your concerns about getting the flu shot today?
Last time I got the flu shot, I got the flu. I'm sure that everyone on here has heard that.
And I'm thinking to myself, if I had a nickel every time someone said that, I would be on the beach retired today.
But you're not actually saying that, which is a really
No, I'm
good
not.
thing.
No, I'm not. It's in my head.
Yeah. But, I think to say, what are your specific concerns? You don't come in and when the patient says, oh, I don't know about getting that flu shot, which Macrina didn't say was, oh, did you get the flu last time you got the flu shot? Or, oh, are you nervous about the microchip that might be in the flu shot? Or, don't give people more things that are going to freak them out. Try and do a little bit of digging, and it never acts, like we said earlier, life is not scripted, so it wouldn't go that smoothly. But we don't want to assume what is bothering them. And we don't want to answer questions that people haven't asked. So really making sure that you can identify what exactly are they concerned about so that you can give them the best information to address that specific concern. And then the other thing that is really important is that people feel heard. So that's what corroboration is. So when I say last time I got the flu shot, it gave me the flu, what Macrina wants to say is, no, it didn't,
Yeah,
did not possible. That didn't happen. But to make me feel heard, something she might want to say is, I'm sorry you got sick with the flu. It's awful. I've had the flu. It sucks. It's, it's really miserable. Just something to make sure that someone feels like you have heard what they say. Another good way of doing that is, I've heard that concern before, just the patient, a couple patients ago asked me the same question, just making sure that people feel heard and that they don't feel alone. Our third kind of general principle is to give your strong recommendation. They're asking you questions because they care about what you think. And because they really respect you and your position in your clinic and what you have helped, you're part of their healthcare team for their family. So making sure that you say the words, I strongly recommend that you get this vaccine today. Another really powerful thing that we hear is when you can say, I believe so strongly in this, I vaccinated myself, or I also vaccinated my children on schedule, making sure that they know you 100% believe in this vaccine. And then we also just want to remind you to be honest. A lot of times we, in an attempt to try and, we all love vaccines so much. You're all your vaccine coordinators for your office, and you do hear some really, crazy off the wall things about vaccines that are completely not true, like microchips and things like that. But remember that it's okay to be honest. If you don't know the answer to a question, just because it sounds crazy and nuts doesn't mean that it is not true. So make sure that you always be honest. That one of Macrina's great stories about this is the walking backwards person. Like that was a real VAERS. What was report, wasn't it?
Yeah, so it had to do with H1N1, and she was a cheerleader for some, I believe, some professional football team, and she got the H1N1 vaccine, and she could only walk backwards. If she walked forward, she had many twists, and she stumbled, and she just couldn't walk straight. But if she walked backwards, she was fine. And of course, they decided to put this on YouTube and on the internet so everyone could see the cheerleader who walked backwards. And so that was a difficult, well, I guess it really wasn't as difficult as it sounded, because, it's just, there was nothing in the vaccine that can make you walk backwards.
Right. But it was on VAERS. It was
But it was on VAERS. She did complete a VAERS. Yep.
Yeah. But I think just to remind you to be honest, especially about reactions, in an attempt to make things better, you would never want to say to a patient, vaccines are 100% safe, because they're not 100% safe. Adverse reactions do happen. That's very rare, but they do happen. If you haven't heard a specific concern before, just make sure that you say that. I haven't heard that one yet. Just be honest. Science is on your side when it comes to vaccines. So don't be scared to give the truth, And then we also just finally want to remind you to never give up, because just because you did not convince that patient to get a vaccine or answer all of their questions, it doesn't mean that the next medical assistant or the next nurse or the next provider is not going to help convince them. We don't make decisions, logically all the time or immediately. Some people need to go home, take what you've said, digest it, talk to their friends at work, talk to their mom, talk to their sister, and all of that is going to help them make that decision. So we have shared this slide a million times over the last number of years. It gets better and better, because if you look at those HPV numbers, that's the areas that I'm looking here, you will see huge improvement over the course of just 5 years in our HPV rates. So many of you kind of complain about recommending this vaccine because it is a sticky thing for a lot of families, and it opens up conversations, and not everyone is perfectly compliant. They still think that this is a new vaccine, but what you are doing is working, because our HPV coverage rates have gotten so much better. And it's because people are taking the time to answer questions of families, really think about their concerns, and people are going home thinking about it and eventually choosing the right thing, even if they didn't in that exam room. So,
and I think the other important thing to remember too is that if we all make sure that we get the right information and we answer the questions consistently, then the more parents and makers hear the same answer to the same questions all the time, the more they actually say, okay, well, this must be really what it is. So that's why it's also really important to make sure you kind of stick to the facts.
And you are all really good at this already, because our vaccine coverage rates wouldn't be as great as they are if you weren't. So even though you are really good at it, that's something, it's human interactions and behaviors, right? So we can always get better at convincing your husband to properly put the dishes in the dishwasher. It's never going to be perfect, but we are all here to try and make each other better, a lot better too. So we're going to go through a bunch of questions and see how Macrina answers them, but please, feel free to chat things in or just unmute yourself. This is the next part of our time together here, is really about all of us learning better ways to talk with patients. But I want to make sure that I look through the chat. before we get there, oh, thank you, Laura. Put in the chat some information about adult PCV 20, PPSV 23. Parent told one of our pediatricians the other day they only wanted vaccines that have been FDA approved 1985 or prior. Have you heard that one? I wonder where they picked that date.
I have not heard that one, which would mean that there would be not a whole lot of vaccines administered to that kiddo. I'm guessing that a lot of these FDA things like this are because of the way things have gone over the last probably 6 months with how COVID vaccine has been approved. I think this might be one of those fallouts we're having.
Right. Okay, so let's dig into all of the hard questions. So this is one that we hear a lot about their itty bitty bodies. Can they take that much vaccine? Isn't this too many vaccines too soon? I want to spread them out. How do you handle this in your practice, Macrina?
Well, first of all, it's not too many too soon. That little baby's immune system, the minute it's born, it gets exposed to so much stuff just there in the delivery room alone. And those little immune systems can respond to so much. The other is that our vaccines have so fewer antigens in them now that we're actually exposing them to less in that first immunization visit than they get exposed when they go outside. And a lot of times it's about too many shots, not too many vaccines. So that's kind of what, I talk about. And I also say
so you find that parents just don't want their kid to get poked that many times?
We find that a lot of times it's not necessarily too many vaccines, but too many pokes. Because when we start, well, I can combine these three. I can combine these three, and then I can give the Hib and the pneumococcal. Then sometimes they're like, oh, okay. So a lot of times it's not about, I jump in to talk about the baby's immune system can respond to so much and gets exposed to so much. But then I talk about really it's only 3 pokes. And then they're like, oh, okay, that's fine. Now it's going to be this many vaccines, but some of the vaccines are combined. So I think that's what I find in probably 9 out of 10 parents. It's the number of pokes, not necessarily the number of vaccines. We found a different schedule. I really talk about the fact that the CDC schedule has been approved for a very long time. I actually talk about the fact that I'm 58 years old and I received DTP at 2, 4, and 6 months, and that they've been following that schedule for a very long time, and that this is the only truly scheduled, and it's scheduled this way so that we protect children from the actual disease. We do see very small number of parents wanting sometimes individual vaccines because they want to know which vaccine causes the reaction. So if they get one vaccine at a time, then they'll know which one, if they have a reaction, they can't get again.
Well, and that's a different risk too. And Jessica, I like that you put that in there because we've been hearing that a lot over the last number of years too. And even on MMR, I mean, it's not possible for every vaccine, right? Some vaccines just come combination. And I think that one thing we've heard at other tips that some people do is use that as an opportunity to talk about putting your child at risk. Like, we don't pick a favorite disease. I mean, how do you prioritize which of those vaccines then you give first and second, and you're leaving your child vulnerable to those other diseases?
Well, and honestly, this is an approach where
it's tested.
Some parents will ask, well, you tell me which vaccines are more important and I should give them today. And I tell them, I have to tell you that all these vaccines are important and all of these vaccines need to be given today. Now, we can sit here and talk, and I can through all the vaccines and the diseases, and then you can make that decision. And a lot of times when I start going through and starting with, DTAP, and I start with diphtheria, tetanus, and pertussis, a lot of them will just finally say, okay, fine, I'll just take them all. and I think sometimes it's when you put that decision back on them and help them kind of, you have to decide which ones. They just don't want to have to decide.
Mhm.
They'll go ahead and take them all.
So for this too many too soon thing, it sounds like the big talking points, depending on what the parents or the patient's specific questions are the big talking points are our immune systems are designed to do this. You know, our immune systems are designed to recognize these vaccines and to recognize it and to respond appropriately. The schedule is studied. And the schedule is tested, and that's the recommendation. And we recommend what ASIIS recommends, and we wouldn't choose one vaccine over another. It sounds like she's also, Jessica's chatting in that more are avoiding the Penicillin Pediatrics and Vexelis. Anybody else have like talking points or tips around this specific concern that you have found successful?
Yeah, because in the population that we normally see here, we don't see that.
Well, you have them more compliant. I mean, they're going all the way to county to figure out. Yeah, you're not. They're
Right.
Doctor's office.
Right. So we don't have that.
Oh, that's good. Asking
That's a good one.
are vaccinated. Yeah. Because most will say yes, and nothing's wrong with me. So another one that we have heard more and more is, isn't it better to get the natural immunity? So how are you handling this one?
Oh, well, with the natural immunity, I always talk about that with vaccines, we know what to look for after vaccine and what we expect as normal possible side effects. And because of theirs, we know where those very slim chance of severe could be. But with natural disease, we don't know how a child's going to react, and we don't know what long-term side effects they could have from that disease. We don't know if your child who gets varicella, if you're going to get encephalopathy, or you're going to get a super infection in a chickenpox vesicle. We don't know if you're going to end up with some severe side effect to the natural, to the disease.
Mm-hmm.
And that's how I answer the question.
That's a great.
And why take the chance? And the other really good part is that even though, we don't see our vaccine rates as high as we'd like them to be, we know that the chance of getting that exposure to that disease is not very high. So the risk of not getting any natural immunity, you could be talking about someone who may get sick later in life and their immune system may not have such a good response. There's all sorts of things. I think the idea of being able to be exposed and get natural disease is not as easy as it sounds anymore.
There's an interesting comment from Adeline around how do you approach it? They say, well, I had HPV while I was pregnant. So why should he get that? Why should my child get the HPV vaccine? I think that might be a misunderstanding about how passive immunity works.
Yeah, there is no passive immunity for HPV.
Mm-mm.
Yeah, it just doesn't work that way.
Mm-hmm. Any other things around how you've been approaching this natural immunity thing? Anybody else have tips? And I see that question in there about ingredients. I know that's not on our slides here. If maybe one of the TAPI folks, if you go on CHOP's Vaccine Education Center, Dr. Offit they have some resources. Maybe if we don't find them now during this session, then we'll make sure to email them out about ingredients. But I think that You are not a vaccine scientist. No one expects you to be a vaccine scientist. You aren't going to know how each ingredient works. So how do you discuss that when people start talking about ingredients, Macrina?
Well, first of all, I talk a lot about the fact that you're exposed to formaldehyde and aluminum in the environment every day. It's just not in the vaccines, but it's in the environment, it's in other products you drink, eat, you're around. I also talk about the fact that the very small amounts that are in vaccines are kept there to make them safe. And usually when you kind of explain that, the one that's really the most successful is that formaldehyde and aluminum are in the environment. You're exposed to them all the time. You're exposed to small amounts, you just get exposed, you flush it out and you get exposed again. Usually that is where most parents will be like, oh, okay.
Yeah.
And they had to ask the question. And so if you give them the answer, a lot of them will just go, okay.
Yeah. Yeah, that's great. Denise is saying the provider says, well, it's only the foods that you eat. I mean, just being able, as always, to put this stuff into perspective. But so maybe points for this natural immunity thing are, we do know that there are risks to getting diseases, risks immediately, and then also long-term risks. And why would you want to take the chance for that? And to me, it's just odd that natural immunity, I mean, the way your immune system responds to a vaccine is natural. Like that's how we've created. That's
right.
The immune responses. It's just an interesting. It's like the organic peanut butter moms. It almost feels like this is like an odd way to make people think that something's unnatural about how your immune system responds anyway. So
well, and a vaccine is just a way for you to build that natural immunity without actually getting sick.
Mm-hmm. Okay, this one we have heard a lot. What about long-term effects on vaccines? And we did find a great video from Dr. Offit, who is my hero. So we'll play this.
Hi, I'm Dr. Zachary Rubin. I'm a pediatric allergist and clinical immunologist practicing just outside of Chicago, Illinois.
Hi, my name is Paul Offit. I am the director of the Vaccine Education Center at the Children's Hospital of Philadelphia and a professor of pediatrics at the Perelman School of Medicine at the University of Pennsylvania.
Do vaccines have long-term side effects?
So if by long-term you mean side effects that don't show up within a few weeks, but show up 1 year, 2 years, 5 years, 10 years later, no. Vaccines can have serious side effects, including side effects that can cause permanent harm, side effects that can cause a child to die. I mean, that is true, and I'll give you some specific examples. I mean, the oral polio vaccine, for example, was a rare cause of polio. It occurred in roughly 1 per 2.4 million doses. It was rare, but it was real. The yellow fever vaccine is a rare cause of something that has the fancy name of viscerotropic disease, which is a nice way of saying yellow fever. It happens in about 1 in a million people, primarily over 65, but it was real. Measles-containing vaccine can cause a lowering of the platelet count, which are cells in your body necessary for clotting. Happens in about 1 in 30,000 people. Again, rare but real. But all those severe events, when they happen within 6 weeks of a dose. I mean, for the 200 years of vaccine development, starting back in the smallpox vaccine, I can think of no example really where a vaccine was found to cause a side effect that wasn't determined for years because it didn't show up years later. Now, sometimes something is so rare, like polio caused by the oral polio vaccine, that you're not going to see it in a study of 1,000 or 10,000 or even 100,000 children. You're only going to see it when it's in hundreds of millions of children, which is the way that was picked up. But in terms of long-term side effects, no.
Yeah, I agree. In terms of what I tell families, the immune response is done within 4 to 6 weeks of vaccination, and the adverse events that occur happen due to the body's own immune response creating those side effects itself. It's not necessarily the foreign substance that is the problem. It's how our immune system responds to it. So as you said, it's going to take millions of doses to find these rare, potentially serious adverse events that occur, which we're not going to necessarily pick up on pediatric trials right away.
So I really love that response for a couple different reasons. One is that see how Dr. Offit just like immediately hits you with the truth. Like, can vaccines cause permanent side effects? Yes. I mean, it is true. It is extremely rare, but it happens. And I think that reminding families about that this is your natural immune response. This is what your immune system does. We just don't remember that stuff, you know? But I really like that response about long-term side effects. Is there anything else that you say, Macrina, for that one, the long-term side effects?
It's about the same, that we give you the vaccine, most side effects are within the first couple of weeks, the time it takes that your body to respond and build an immune response. And then there are no long-term effects. That vaccine stops working after a while.
Mm-hmm. So how do you know vaccines are safe?
Well, I usually talk a lot about the fact that I've been doing this for a very, very long time, and that I've administered a lot of vaccines to a lot of children. And I have only heard of 2 severe reactions in my entire career. And that vaccine safety is number 1. That's the first thing they look at before they even let a vaccine move on to finding out if it works. They want to know if it's safe, and that is the most important decision they make, whether to move on to other clinical trials. That's how I answer the question.
Anybody have other talking points that you use when you're talking about how do you know this is really safe? It seems like people don't ask that question specifically, you know, either. It's more of a, what about long-term side effects? What will the reaction be? Kind of misunderstanding about reaction.
Right.
I heard from my sister's cousins, next door neighbors, grandmothers, you know, that they got this vaccine and this happened, you know, so it seems like it's that question.
We still get a lot of back in the old days where it was whole cell pertussis, which did cause some significant side effects. So we still get some of that here, you know, who will say, you know, my mom said that when she got her, you know, DTP, she had a severe reaction. This is what happened. And so I don't want her to get that. And then you just have to explain that. And the vaccine is safer. That little A is acellular pertussis. It's a much safer vaccine. You don't have to worry about it. Causing those effects. So a lot of people have like these long urban legends that have gone on over time with family.
Right. Michelina's saying that she talks about that vaccines are studied a very long time before they're approved. So, which it'll be interesting to see if patients respond to that in the same way as they have previously, because, you know, of mRNA technology, and vaccines are going to be hitting the market much faster. And because of Operation Warp Speed and us getting science and money together in a beautiful way to give us COVID vaccines so quickly. When we were in the midst of a pandemic. So that'll be a neat one to monitor, whether that is effective or not. I have spent so much time at COVID vaccine clinics in the last, you know, few years, but I hear about these parents that let their child choose whether to get a vaccine or not. But I have to say, I've been doing these tips for how many years? 7, 8 years. And I've always thought, oh, how common is that? Well, after sitting in these schools at these COVID clinics, now I see that there are a lot of parents. My mother would have never let me choose whether or not I got a vaccine. I would have never thought to question that. But what do you think?
I don't think my mother let me choose when I was 40 whether or not to get a vaccine.
But apparently these parents do exist, and they let their small children decide whether or not they want to receive a vaccine. So how do you approach that? And I didn't know that you had a reaction. I really like Rosa's reaction there on her screen.
Oh yeah, no, that's mine. So how I handle it personally when I'm doing this is when you ask the child, whether they're 5 or 6 or 11 or 12 or 16 or whatever, when you ask the child and bring them into the conversation I'm having with you about screening immunizations, I figured you're bringing them into the discussion. So even when a parent looks at it and I go, you know what, today you need your last DTaP, polio, and second MMR and varicella. And oh, by the way, you also need to get your second Hep A today as well. And the parent looks down and says, well, do you want that additional vaccine? I just pulled a little kiddo in and I said, well, you know what? If you get them all today, then you're done. You don't need to come back until you're 11. But if you don't get them all today, you're going to have to come back sooner. Wouldn't it be great just to get them all done? Again, I feel like if the parent's going to bring them into our conversation, then I feel, and I handle it in that way. I have to say that probably 599 times out of 600, I do not get yelled at. The parent sort of jumps in and says, no, that's a great idea. Let's just get them done. But I do have an occasional parent every now and again that will tell me to stop talking to their child. It's not they're the parents in charge. I'm the one who makes the decision.
You know, it's interesting. Jessica in the chat is saying that she hears that, especially with the flu vaccine. And it does feel like we have this perception that the flu vaccine is this like optional, get it if you want, don't get it if you don't want. But if that child gets flu, who's the one who has to stay home from work? Who's the one that needs to, you know, make sure that everybody's taken care of, especially if they too get the flu, you know, being sick and still having to take care of children and spouses and dogs and cats and everybody else is not really fun. So, but that's interesting. And Rosie's saying she agrees that she hears it in the flu as well. But why do we think flu is an optional vaccine? I mean, they're all optional vaccine. I mean, we obviously consent to each of them individually, but why is flu so special? Is it because we get it every year?
I also think it's because flu, I always talk about flu doesn't get the respect that flu deserves, that everything's the flu. If you have a head cold, it's the flu. If you have allergies, it's the flu. If you have diarrhea or nausea, it's the flu. I mean, if your shoulder hurts, it's the flu. I mean, I think it's because flu doesn't get the full respect that flu deserves. And having had the flu and being sick for 2 weeks and remembering my mom sleeping on one of those old patio chairs, you know, next to my bed at night, worried because my fever was so high. That's the flu.
Mm-hmm.
I think a lot of times when they start talking about, oh, it's just the flu, I say, well, no, it's not just the flu. We need to really respect the flu. Here's what the flu is. Because I think flu just doesn't get the respect it deserves as a vaccine preventable disease.
Right. Okay, so when you have these parents, let them open, if the parent is welcoming the child into the conversation, as the provider, feel free to also engage with that child, but remind the parent that they are the ones who consent to medical decisions for their child, and it's their choice. And that is a good reminder for folks to hear. And I cannot believe Angela is saying that they also let them choose whether they want to go in a car seat. That is so scary for me. And people are agreeing with you. Yep, people don't realize what flu is. It doesn't help that Dayquil and all of those medications are cold and flu. You know, like we lump it in, like the whole industry kind of markets it as like the same thing too. You don't get the flu for a day.
Right.
Okay, good.
And NyQuil just makes you not care about the fact that you had the flu. It doesn't cure the flu.
Yeah.
There's one thing, you know, the difference between curing something and the difference between just helping you with the symptoms, it's two completely different things.
Mm-hmm. Yeah, and let's hope to Linda's point, you know, because the flu vaccine is not always, you know, a perfect match, and making sure that we continue with our messaging that the purpose of the flu vaccine, and this goes for COVID as well, you know, COVID vaccines are doing what they're supposed to do. They are reducing hospitalization and death. That's what flu vaccines do too. You know, it's not it's a guarantee that you're not going to get infected. It's just a guarantee that you are much less likely to have severe complications. So.
Right. And I think also what's going to be interesting to see is that this new mRNA technology that we use with COVID vaccines is going to mean that when you manufacture flu vaccine, you're actually going to be able to wait till it gets a little bit closer to the flu season so that match is going to be better. Because now you're just guessing that what happens in the Southern Hemisphere is going to make it to us. So I think in the future, the flu vaccine match will get better over time.
That's great. Okay. Why should I get the flu shot? I never get the flu.
Why should I wear a seatbelt? I've never been thrown out of a car.
Yeah.
I mean, I don't normally say it like that. I word it a little bit better. I do word it much better, but I'm like, there's a lot of things we do to protect us from stuff not happening. So I always say, I'm so glad you've never gotten the flu, but let's not test your odds here. Let's go ahead and get a flu shot today.
Yeah. Flu shots are always so hard. It might be helpful to have kind of sometime. When are you going to get flu in? August, September, October? It depends. We don't know, huh?
Right.
Yeah.
Well, now it's, and I think again, it changed now the way you really don't want to start immunizing adults until October, especially our older adults. So we'll start seeing flu come in about September.
Oh, what a great idea. Angela's saying every year you don't get the flu, it increases your chance of getting it the next year. That's a really good. Yeah, it is a numbers game, just like what you were saying about the whole natural immunity thing. I mean, why take the risk? Why take the chances? And hopefully for some people that they will embrace that a little bit differently, because we do know people, perfectly healthy people in the last few years who've had some really serious impacts from COVID, either they're long or I was just talking to my sister whose next door neighbor had a cough for like 6 weeks, perfectly healthy 40-some-year-old woman. And that is what helped my sister kind of decide around, like, really validated vaccines and the importance of vaccines for her, because she saw her friend really sick, just not able to stop coughing for weeks and weeks and weeks.
Well, and I always like to use Dr. Lewis's discussion when it comes to flu. Think about if it was your wife or your husband, or if it was your child or your father or your mother. And what if they were a police officer and they decided not to wear a bulletproof vest? Because basically all it protects is this area here, your chest to your waist area. It doesn't protect your head. It doesn't protect your legs. It doesn't protect your arms. It only covers, maybe 30% of your body. How would you feel if they said, I'm not going to wear a bulletproof vest because it only protects 30% of my body? You would say, you've got to be crazy. So the fact that a flu vaccine is anywhere from 30 to 60, maybe if you're lucky, higher than that percentage protective, it is pretty darn good at stopping you from getting severely ill, hospitalized, and dying.
And Susan's saying she's seeing flu in some students already.
We are too.
Why?
I don't know.
Last year's flu? Some years we do get a late.
I think the one thing we learned from H1N1 is that flu is, even though we see increases during seasonal, like October through February, flu is circulating all the time. We just don't have outbreaks of it.
We still continue to hear this question: do vaccines cause autism?
And this is probably the one where I'm the most firmest. I'm like, no. There have been several studies, millions and millions of dollars of studies that have gone to disprove this right now, that vaccines cause autism. Vaccines do not cause autism. In fact, Autism Speaks is one of the largest organizations to support families with children who have autism, wants this to stop. They say vaccines do not cause autism. We want the money that goes to these studies to go to actually find out what does cause autism.
Sorry, we just woke up from a bad dream apparently over here.
And when parents find out that the largest organization that supports families with children with autism agrees that vaccines do not cause autism, a lot of folks are more likely to get.
Put a good look in there for resources to give parents. Another thing that we have heard tips people before is that they use this as an opportunity to talk about developmental milestones, because usually this question is for very young children. You know, that's parents are concerned about it at that at those younger ages, and it's just a good opportunity to also talk about typical childhood development, that we do ASQs or PEDS developmental screenings here in the office, and to monitor your child's developmental progress. And I just think that's such a great idea that we've heard other, folks doing. So really good idea, because we do need more awareness about what typical development is, and to watch for early warning signs so we can get kids into services when they need it, so that, we can lower that diagnosis age. So we have about 10 minutes-ish left. Are there any other questions that you guys are hearing, or things that you're really struggling with about how to overcome objections? What other, feel free to unmute yourself and or continue participating in the chat. What else are you hearing? Nothing.
Silence.
We've gotten in a bad habit of being quiet on our. Maybe we need to give out more prizes to get people talking more next time. I've heard a lot around the COVID vaccine, just questions around the boosters. Like, are we going to have this every year? If we're going to have it every year, does my child need it every year? Those are just kind of the newer ones that I've been hearing. COVID related, do newborns need Hep B? Because this one. So that newborns don't need the Hep B vaccine because they don't need it till they're 16 when they're sexually active. Had one today. Oh, that's because that Hep B one is given at birth. Yeah.
Yeah. So we're not really giving, I explain a lot about that birth dose. We're not really giving it. We're not giving that birth dose to protect them from exposure when they get older. We're giving them that birth dose to protect them with exposure at birth, and the risk of exposure at birth. So, and a lot of times I'm like, oh, so when did 16 become like the moment you become sexually active? Everyone is 16 now?
None of the moms are agreeing with you who have 16.
Yeah, and that's usually what I say. My favorite is they want to wait to give HPV until they're 16 as well. So it seems like 16, getting your driver's license and sex seem to happen at the same time. A lot of it has to do with the fact that also their immune systems are so robust. They get such a great immune response when it's given younger. And we actually give that hepatitis B at birth because we know that if a mom is not screened and has hepatitis B or is a hepatitis B carrier and isn't screened during pregnancy, then that baby has almost 100% chance of being a hepatitis B carrier. So we actually immunize the entire population to protect those kiddos that are at risk. And the good news is you just get one over.
Yeah. Well, and that again, getting back to helping educate your families about how their immune system works, the younger that we can get a vaccine, the stronger that immune response is going to be. I mean, we always want and then they're not going to be exposed and all of those, it's always good.
Yeah, and
better.
it's always, and that's always such a good way when I talk about HPV vaccine is look at it. When you start younger, you only need 2 doses because of how great the immune system is.
Mhm.
Because it just builds such a great, robust response. And that's how I explain flu with, that's why, us older adults, 50 plus, those older adults get a hyper dose of flu. It's either much more the volume or they have to adjuvant it so that it produces the same response that a kiddo can get. Those immune systems are incredible.
A lot of sick kids not getting their vaccine. So, I'm reading that. I don't know if this is what Susan's saying, but as we're not going to get our shots today because he's sick. But we want to always screen for sick and well visits. And if a child does not have a fever, then it is not a contraindication, right? They can get their vaccines. Is that accurate, Macrina?
Yes. As long as there's no fever and as long as they're just mildly ill.
Right. So make sure that you guys are always giving that strong recommendation, even for your screening at sick visits and you're offering at sick visits too. Don't miss any opportunities if there's not a contraindication. And for Hep B, remember you can get Hep B from things besides sex. Yeah, that's a good reminder too.
Yeah, and Rose, I agree with you. I think the messaging is going to have to get much better as we go on. And if COVID becomes a yearly vaccine, like they're talking about, explaining to patients that they need both, they're 2 separate viruses. I think the messaging is going to be really important.
Mm-hmm. And to Yvonne's point too, that you may, getting the flu shot did not give you the flu, getting the COVID shot did not give you COVID. You were probably exposed before you had that vaccine, so you were immunized when you had it.
And that's why I always tell folks, we have a lot of folks who say, I'm going to wait till, I'm going to wait until we get, crowds, when the news crews all actually at the hospital and the emergency rooms are packed with people and flu is everywhere. You need to get that flu vaccine, by the end of October, early November. Don't wait until January and February, because chances are as you're heading out to get your flu vaccine, you're being exposed to flu at the same time because it's so community spread.
Yep. And Adeline's saying that she had a question the other day around, can I get COVID vax? Do I have to wait to get Tdap or MMR? Or we hear that a lot with shingles. Oh, I don't want to get my COVID shot today because I finally got the call that I get my shingles vaccine at the pharmacy. That is like a carryover from early days of COVID vaccination. You can administer COVID with any other vaccine. So tell your doctors that. A lot of them have not gotten that message yet either. And tell your patients that. And good shout out to Laura Smith for being awesome. Always email us in between these meetings for questions. So I had a teen recently pick up trash and got poked by a needle. Oh, that's a good way to get Hep B. Huh.
That is a very good way to get Hep B. And unfortunately, with especially here in like the Phoenix metropolitan area, where we're starting to see more of a homeless population and things like that, there is more risk. So definitely, that's another good reason. To make sure they're immunized.
Yep. Any other questions or stuff that you all are hearing? This is like the one where I really miss the in-person tips, because it's really great to hear you all about how you overturn this stuff, because you're hearing it every single day. And sometimes it does feel kind of like we have to throw everything at the wall and see what sticks, because 1 week in South Pima County, they're hearing HPV vaccine causes this, that, and the third. And then all of a sudden, in that community, now they've shared that on WhatsApp to their relatives in Flagstaff. And these myths kind of trickle. We see them trickle throughout the state. And it's really great to hear how you all respond to those things as they're coming up. We always, not joke, but if it's pretty hard to give something to someone who's worked in vaccines for a long time, it's pretty hard to find an objection or hear something that you haven't heard before, because you could hear something and then not hear that concern or that issue brought up. And then all of a sudden, 5 years later, it starts popping up again. So it's really great to create these opportunities for you all to just be able to kind of troubleshoot with each other about what works.
And honestly, a lot of how I respond and some of even the folks I work with respond is because when we've done these tips, I've learned a lot from you guys out there, because you know, we all hear different stuff, and then it's kind of nice. It's almost like a therapy session. This module is for me when I go out and do it live. It's sort of like it gives us time to laugh, come up with creative ways on how to respond.
Yeah.
Walk away learning more than I ever teach when I do this session.
Well, and tell the funny stories of like the big giant tattooed guys who run out of your exam rooms crying because they're scared of needles, even though they've gotten, you know, entire sleeves on both arms. So it's always great to hear those stories from the field from all of you. It is 1 o'clock. We hope that this was helpful. We'll keep the line open for just a little bit in case you have other questions and things like that. And otherwise, we'll be back next month to talk about vaccine administration. So we appreciate all of you. Rosa's saying that parents saying the only vaccines I want are the ones required for schools. And that is the one that gets under my skin the most. And we're doing a lot with schools to educate them too. Some your school nurses they just work so hard. But really good school nurses have started to say to families like, yes, this is what's required for school, but this is what's recommended by CDC. This is what your child's doctor is going to recommend. So if we could just get everyone to take school requirements out of their language and just talk about what's recommended by the scientists, it would be wonderful. But we hear you. I think people really struggle with that. And the recommendations for school don't match ASIP.
Nope.
Yeah.
And that's a tough one. That's when that adolescent visit, where that strong recommendation of today, they're going to get a Tdap, HPV, and meningococcal vaccine. You just say it one sentence. You put HPV in the middle. And if the parent says yes, then there's absolutely no need to say, well, these two are required for school and this one is recommended.
Oh, and Tdap doesn't match the schedule either, right? But offices shouldn't know. Your job is to do the ASIP schedule, not the school requirements. Those poor school nurses. Oh. Anybody else have questions, even not related to this stuff? I think we're easy today. All right. Well, we'll see you next week. We'll talk about poking those little kids and pinching those fat little legs and getting your syringes in there. So everybody have a great month.
A great one. Bye.
Bye-bye.